My name is Andrew Schneider. I am a DDS, Doctor of Dental Surgery. Got my training at UT Memphis, class of 1999, and I am the managing doctor at this location, Springfield. I have been practicing dentistry 26 years. I've been placing implants 15 years of that. I cannot tell you the number of implants. I'm sure it's been thousands, and arches pretty close to that too. I've probably done about 1,000 arches at this stage. Why did I choose to get into dentistry? Well, fun fact is I started out as an electrical engineer. Got my basic first 2 years of college training in engineering and realized I didn't want to be a numbers people. So I decided to be a people person. So I went back, got my degree in biology, and wasn't sure what field of knew I wanted to be in health. Wasn't sure. Somebody said, "Have you ever thought about dentistry? Go take the test." I took the test, got accepted, and that's history. All in four patients, like all patients that we see with dentures or overdentures, they're kind of crippled dentally. They're missing teeth. There's a lot of decay. They're in pain. They want to be back to where they were when they were younger, when their teeth didn't bother them, and that, which we can achieve very well with fixed, and they have something they can depend on for the rest of their lives. Most people, when they come in, they're embarrassed. They're embarrassed about their smile. They take it as a personal embarrassment that something they did. There's a lot of factors that can cause the need for fixed dentures, overdentures, and traditional dentures. We have to discuss that and let them know that we can get them their smile back, their function back. They basically believe it's their fault where they're at, which is not always true because they're afraid that we're going to judge them in that. No, it's part of life. We need to get them in and take care of them, give them their smile back, give them their ability to chew. They'll be healthier, happier individuals if we can do that for them. Well, when I sit somebody down the first time, I kind of like them to find out what they'd like to do. Some people don't know what they want to do, so we have to kind of discuss the options they have, and that's where we start. We kind of explain to them what we can do for them, the different options, and then let them choose what's best for their situation. I try to explain to them I do my best to keep them comfortable, and they do have choices in the matter. So they need to let me know when they're comfortable, what they're not comfortable with, and I'll try to help them the best I can. On a all-in-4 surgery day, basically it's a matter of getting the patient comfortable, giving their medications, getting them numb. It's not too bad after that. Once we do, it's a matter of getting teeth out, place the implants. What usually takes the longest is getting their new teeth ready. We have to pick them up and make sure they fit right and adjust them, and that does take a little bit of time. So it's several hours they'll be with us just to get the teeth right. Well, in our office, we use an oral sedation. It's something they will pick up from the pharmacy. Once they get to our location, we give it to them, and we give them time for it to take effect. Everybody's a little different. We kind of gauge that. Once we do that, then we start with numbing and the rest of the surgery. When we do our fixed or our all-in-4 arches, I'm a little different. I know some people will place the implants and then design the teeth around it. I go the other way. I have digital technology. We do facial scan, intraoral scans, and we design everything three-dimensionally. That way they can verify that's what they're wanting before we get started. Last thing I want to do is if something's not quite right, we need to change, that the implants won't support the smile that the individual wants. So we approve it first and work our way back to make sure the implants can give them the teeth they want. All-in-4 implants, it's kind of like a car. If you take care of it, it can last you a lifetime. If you don't, it can have issues. Would not recommend all-in-4 if it wasn't a long-term prosthetic.
What do you see change in patients after they get their teeth back beyond just a smile?
Okay. Smile, definitely. It's the first thing you can notice with these patients. But they seem to have more energy. They are more energetic. I think it's because they can eat better. They're eating a more proper diet. Their bodies are reacting to that. They become a whole individual again. If somebody thinks they're too old, do you not deserve the best? As we get older, we still need to eat. We still need to smile. We all deserve the best, no matter our age. Concerned with the cost? Once again, are we not worth the best? Why would we want to spend the end of our life not functioning as well as we could? People don't have enough bone. Well, sometimes we can find that bone. I may not be the surgeon to give you a fixed smile, but I do work with other doctors that can use what I like to call extraoral bone and still achieve the same result as a all-on-4. Dentures are prosthetics to kind of replace teeth. If we were going to use it like a leg, it's a pirate leg, it's a peg leg. It will give you function, but it's not the best choice. All-on-4 would be the bionic leg. And yes, they make bionic legs, and it would give you the most function, the best prosthetic that we have available to us. How am I different than other offices? Well, I've never been in another office, so I can't answer that question. I can tell you I use the best technology. I design guides and appliances so I can place implants what I believe is the best for the individual. I do no less for one of my patients than I do for myself. If you're suffering with your teeth, all I can say is why put it off? It's not going to get better with time, it gets worse. If you want something like fixed, the sooner you do it, the better results you can get. I can perform for you and you can have. So don't waste time. Basically, if you need a new smile, you are considering this, the sooner you do it, the happier you'll be. The sooner you do it, the better the prosthetic you'll get. Don't waste time. Come in and see me. See what I can do. We want to help you.